Minister, I want to talk for a few minutes, or what little time I have left here, about vaccines. Um, there is an awful lot of stress and anxiety in these northern and remote communities, as you can imagine. And I know you've been talking to these people, and we would agree that that's a huge concern. Um, where I'm going with this is I believe there's an opportunity for us here to really give them some hope, to really share some optimism, to really give them uh, a light at the end of the tunnel, so to speak. So I guess what I'm asking is what's the plan for a rollout of vaccine? What's the access going to be in these remote communities as far as a vaccine when that opportunity arises?
This is an excellent question, and it's one we're working on uh, currently. What we're seeing, and we've all seen the news stories about the positive results on two vaccines in particular, and the wide suite of access in terms of the other vaccines that Canada has. But this has to be distributed in a way that reflects not only those in the healthcare services needing and prioritization to be established with respect to who gets them and when, but also what is perhaps one of the largest logistical challenges in vaccination worldwide that we've ever faced. And that's the reality, whether we're talking about ensuring that these vaccines are transported to areas and then deployed in an equitable fashion that recognizes the inequalities that we've all talked about on this committee. And certainly our teams, and I see Valerie Gideon on it, are working night and day to ensure that we'll have an approach that reflects not only the need to ensure that vaccines get into communities, but also deploying it in an effective and culturally sensitive way. We all have learned experience from the H1N1 uh, vaccine and some of the challenges that were faced there. They were surmounted, and in fact, I think testimony has shown that Indigenous communities received a higher rate of vaccinations finally. But there were some challenges at the beginning. We won't want to face those again, but we're very, very aware of them and working not only with local leadership, but with health authorities to ensure that there is a proper deployment of those vaccines in a way that I've described.
Maybe just if I could drill a little bit further, just specifically in the context of some of the reports we're hearing about the extremely low temperatures that these things have to be maintained at. And I mean, obviously that's a huge obstacle when we're talking fly-in communities and whatnot. I'm can either you or maybe one of the officials just flesh that out in a little bit more detail for me. I seriously, I just want to make sure that we have a plan, that we're offering these people the hope that they need to get through this.
I'd leave the last few words to Valerie Gideon.
Sure, absolutely. So just to be clear that the vaccine will be distributed through provinces and territories, and it will be done in partnership with the National Microbiology Lab and the Public Health Agency of Canada. Our role will be to certainly administer or fund communities to administer the vaccine when it arrives at community, but we're going to be leveraging the same supply chains and the same distribution mechanisms as the provinces and territories will be using for all of their citizens. There is work that has already been underway and some information released on the prioritization approach that will be taken, and that is being developed at a federal, provincial, territorial level, and with expertise that we're able to bring to the table. But I just wanted to reassure you that we're not going to be treating sort of the Indigenous people's vaccine through a different supply mechanism that might be more vulnerable. We're going to be leveraging the provincial territorial distribution mechanisms, and the National Microbiology Lab will be instrumental, and the Public Health Agency, in terms of ensuring the provision of the proper supplies and equipment to support the integrity of the vaccine throughout the process.
Less than a minute, Gary.
Thank you. Minister, one last quick question. There's a, as I know you're aware, there's often a significant level of mistrust with kind of institutions and whatnot from some of our Indigenous folks in their communities. And in regards to the vaccine, sorry, I can hardly say the word. In regards to the vaccine, is there any kind of strategy or planning in the context of making sure that people that have an inherent mistrust of the system, so to speak, will have the confidence that they need to participate with the vaccine?
30 seconds.
Absolutely, it's key not only to respecting the reality of, and the lived experience of Indigenous peoples with the medical system, but also the effective deployment of the vaccine. So these are issues that we've been working on internally and with leadership in the last little while. I would say that they remain to be perfected. I think when you speak about hope, I think people should be very hopeful given the results that we've seen. But we also have to maintain vigilance in ensuring that the public health guidelines are followed properly, and that's something that we need to continue to do. But that all has to be delivered and administered and work with in partnership with First Nations
I'm sorry.
Indigenous communities, and we'll do so, and that includes many ways of doing it. And I'm glad to come back to committee at a later time to discuss that in more detail.
And I'm sorry that the time has run out for this session. Thank you so much, Minister, and the senior officials for joining us.